Medical mysteries. Can you diagnose the heart disease? Medicine is full of mysteries waiting to be solved. Among these, heart diseases stand out as some of the most intriguing and challenging puzzles. Today we invite you to step into the shoes of a detective. Your task? To diagnose heart diseases based on patient stories and symptoms. Welcome to Medical Mysteries. Can you diagnose the heart disease? We'll present 3 cases, each with its own set of clues. Your job is to use your knowledge to guess the correct diagnosis. After each case, we'll reveal the answer and explain the reasoning. Ready to test your skills? Let's dive into our first case and see if you can solve the heart mystery. Our first patient is already waiting. Let's meet them and see what clues they provide us.
Meet John, a 52-year-old accountant. I've been experiencing chest pain for the past few weeks. The pain usually starts when I'm exerting myself, like when I'm climbing stairs or carrying groceries. It feels like a pressure or tightness in my chest and sometimes radiates to my left arm. The pain usually subsides with rest. My medical history reveals that I have high blood pressure and high cholesterol. I am a smoker and have a family history of heart disease. Recently, I have also been feeling more fatigued than usual. I decided to see my doctor after one particularly intense episode of chest pain. The doctor conducted a physical examination and ordered an electrocardiogram, or ECG. The results showed some abnormalities, but the doctor needed more information. What could be causing my symptoms?
Now let's dive into the hints that might help us uncover John's heart condition. Hint 1. Consider John's risk factors. High blood pressure, high cholesterol, smoking, and family history are all significant. Hint 2. Think about the nature of John's chest pain. It occurs with exertion and eases with rest, which could indicate a specific type of heart condition. Hint 3. Note the radiation of pain to the left arm. This is a classic sign often associated with heart issues. Hint 4. The ECG abnormalities point towards an electrical issue in the heart. Combining this with the other symptoms gives us a clearer picture. Take a moment to think. What heart disease fits John's symptoms and risk factors? Pause here if you need to make your guess. Ready for the answer? Let's see if you got it right. John's symptoms and risk factors point to a common yet serious heart condition, coronary artery disease, or CAD. Coronary artery disease occurs when the coronary arteries, which supply blood to the heart muscle, become narrowed or blocked due to the buildup of cholesterol and other substances. John's chest pain, known as angina, is a hallmark symptom of CAD. It occurs due to reduced blood flow to the heart, especially during physical exertion when the heart demands more oxygen. The pain radiating to his left arm is another classic sign. The ECG abnormalities support the diagnosis. They indicate that John's heart is not receiving enough oxygen, leading to changes in the heart's electrical activity. Treatment for CAD includes lifestyle changes, medications, and possibly procedures like angioplasty or coronary artery bypass surgery. Great job if you guessed it right. Now let's move on to our second patient.
Section 5. Case 2. The shortness of breath puzzle. Meet Sandra, a 68-year-old retired schoolteacher. Sandra: I've been experiencing shortness of breath for several months. Initially, it only occurred during physical activities, but now I feel breathless even when resting. Sandra: I also notice swelling in my ankles and legs. Sandra: I have a medical history of diabetes and high blood pressure. Sandra: I've gained weight recently and feel fatigued most of the time. Sandra: I occasionally wake up at night feeling like I can't catch my breath. Sandra: Concerned, I visited my doctor for an evaluation. Doctor: The doctor noted that my heart sounds are abnormal and ordered an echocardiogram. Doctor: The test revealed that my heart is not pumping blood as efficiently as it should. Sandra: What could be causing my symptoms?
Let's explore the hints that will help us solve Sandra's case. Section 6. Hints for Case 2. Hint 1. Consider Sandra's symptoms of shortness of breath, even at rest, and swelling in the legs. These are key signs. Hint 2. Sandra's medical history of diabetes and high blood pressure can contribute to her current condition. Hint 3. Note the abnormal heart sounds and the echocardiogram results. They suggest an issue with the heart's pumping ability. Hint 4. The fact that Sandra wakes up at night feeling breathless can be a crucial piece of the puzzle. Take a moment to think. What heart disease could Sandra be suffering from? Pause here if you need to make your guess. Ready for the answer? Let's see if you got it right. Section 7. Solution and explanation for Case 2. Sandra's symptoms and test results point to a condition known as heart failure. Heart failure occurs when the heart is unable to pump blood effectively, leading to a buildup of fluid in the lungs and other parts of the body. Sandra's shortness of breath, especially at rest, is a classic symptom of heart failure. The swelling in her legs, known as edema, results from fluid retention. Her medical history of diabetes and high blood pressure are significant risk factors for heart failure. The abnormal heart sounds and the echocardiogram findings confirm that Sandra's heart is not functioning properly. Treatment for heart failure includes lifestyle changes, medications, and sometimes devices or surgeries to improve heart function. Well done if you identified heart failure. Now let's meet our third patient.
Section 8, Case 3, The Night Sweats Enigma. Meet Paul, a 45-year-old construction worker. I've been experiencing night sweats, fatigue, and occasional chest discomfort for the past few months. I also notice a racing heart and palpitations, especially at night. I have no significant medical history and do not smoke or drink. Concerned about my symptoms, I visited my doctor. During the examination, the doctor heard an abnormal heart sound and ordered a series of tests, including a chest X-ray and an echocardiogram. The results showed an enlargement of the heart chambers and some fluid around the heart. I'm anxious to find out what's causing my symptoms. What could be behind my mysterious condition?
Let's delve into the hints that will help us uncover Paul's heart disease. Section 9. Hints for Case 3. Hint 1. Consider Paul's symptoms of night sweats, fatigue, and chest discomfort. Hint 2. The racing heart and palpitations suggest an issue with the heart's rhythm or structure. Hint 3. The tests revealed an enlarged heart and fluid around it. These findings are crucial to the diagnosis. Hint 4. Think about how these symptoms and test results could be interconnected. Take a moment to think. What heart disease fits Paul's symptoms and test results? Pause here if you need to make your guess. Ready for the answer? Let's see if you got it right. Section 10. Solution and explanation for Case 3. Paul's symptoms and test results indicate a condition known as cardiomyopathy. Cardiomyopathy refers to diseases of the heart muscle that affect its size, shape, and structure. It can lead to heart enlargement and fluid buildup. Paul's night sweats, fatigue, and chest discomfort are symptoms of cardiomyopathy. The racing heart and palpitations are caused by the heart struggling to maintain a normal rhythm. The abnormal heart sound and the echocardiogram findings confirm the diagnosis. The enlargement of the heart chambers and fluid around the heart are significant signs of cardiomyopathy. Treatment includes medications, lifestyle changes, and sometimes devices or surgeries to manage symptoms and prevent complications. Congratulations if you guessed cardiomyopathy. Let's summarize what we've learned today. Section 11. Conclusion. What have we learned? Today, we embarked on a journey to solve 3 heart mysteries. We diagnosed coronary artery disease in John, heart failure in Sandra, and cardiomyopathy in Paul. Each case presented unique symptoms and challenges requiring a keen understanding of heart diseases. Through these cases, we learned to recognize key symptoms like chest pain, shortness of breath, and palpitations. We also saw how medical history and diagnostic tests play crucial roles in forming a diagnosis. Understanding heart diseases is essential for any medical professional. Keep studying and honing your diagnostic skills. The heart is a complex organ and there's always more to learn. Stay curious and keep solving those medical mysteries. Thank you for joining us on this diagnostic adventure. Until next time, keep your stethoscopes ready.